Well, good evening, everyone. I'm Mike Redford, and this is the follow-up. Coming up on tonight's show, what else? The coronavirus, of course, focusing on the impact and our local response. In our studio tonight is Joel Strasz. He is Bay County's top health officer, working on the front lines of this pandemic. He will provide us with the very latest information, what we need to know at this point, and what we need to do to protect ourselves, our families, and our neighbors. But first, we'd like to hear from you to help drive the conversation here on the follow-up. You can do that here in a variety of ways via social media on Facebook and Twitter. You can also email us or dial into our follow-up hotline. And if you'd like to see any of our past shows, just log on to deltabroadcasting.org. Now, before we go to Joel, let's update the most up-to-date numbers on the coronavirus, or COVID-19 as it's also called. Worldwide, there have been more than 195,000 cases and 7,900 deaths. Here in the U.S. this afternoon, we passed 5,000 cases and 100 deaths. And here at home in Michigan, there have been 65 cases. Thus far, no deaths, but there were 12 new cases today. And as you can see by that map, the majority of the cases here in Michigan are in the southeastern part of the state, Metro Detroit. In fact, 52 of the 65 cases in the state are in southeast Michigan. As for mid-Michigan, thus far, there has been only one lone confirmed case. That's here in Bay County, but keep in mind hundreds more people are being closely monitored for symptoms. And with that, we bring on Bay County Health Officer Joel Strasz. Thanks for coming in tonight.
Thank you.
I know you've been working tirelessly 24/7 to try to get ahead of this thing, so much appreciated. So let's get into it. Just this afternoon, I know Bay County declared a state of emergency. Other counties have as well. So in essence, what does that mean? What are we going to be doing differently because there's a state of emergency?
Okay. Well, there's already been a national state of emergency that was declared by President Trump. And then there was the state of emergency that was declared by Governor Whitmer. Today, when my boss, County Executive Jim Barsha, declared the state of emergency for Bay County, it did two things. Number one, it acknowledged that we are in an emergency state in Bay County for a variety of reasons. Number one, we have a positive case. But number two, we are pretty much mobilizing the entire county infrastructure to fight this particular virus, which is unprecedented.
Sure.
Normally during outbreaks, it's an enhanced effort by the local public health department, the state health department. But with this global pandemic, it really has the opportunity to do some pretty catastrophic things. And so we needed to mobilize everything. We've pretty much cut back or curtailed most of our services at the health department. I've got about 90% of my staff working on this particular thing. We've got multiple departments in the county that are working together on this. We are working closely with McLaren Bay Region, the EMS agencies, the police departments, the sheriff's department, a whole plethora of different county agencies and different county organizations. They're coming together in a variety of different ways, but primarily to do what they call non-pharmaceutical interventions to really slow and retard the growth of the virus so that we don't have an immediate an immediate peak.
Right.
Right away, because when you have a spike and a peak in cases right away, that will tend to overwhelm the healthcare system, and that can have a pretty catastrophic outcome. As you may be aware, Bay County has the highest percentage of seniors in the state of Michigan, 26% over the age of 60. Those are the folks that are most at risk. And in addition to that, people with chronic conditions, whether it's COPD, heart disease, diabetes, asthma, kidney disease, immune disorders are also at risk from this disease. And you add those things together, you have the potential for a perfect storm of people that are just going to be deluging the healthcare system. And quite honestly, there's just not enough beds, there's not enough vents, there's not enough respirators out there to manage this. And so we all need to do our part as a community, work together, social distancing, staying at home. I know it's pretty difficult to do so far, that there's some pretty severe economic consequences as to what's happening. But the alternative to this is that there is going to be casualties, and many, many casualties. And if we don't do something immediately, it's going to get bad.
Yeah, speaking of sort of the healthcare system and how that's going to be stretched, the one lone case that we have in Bay County is a physician at Covenant Healthcare in Saginaw. We're not releasing the name. It's a man. But what else can you tell about him? Do you know how he got it? What's being done to sort of identify others that may have interacted with him?
So we were notified last Thursday of this particular case, and that the specimen was sent to Lansing for testing. On Friday night, about 6 o'clock, I was notified by the state that the test was positive, that it had connections to Covenant Healthcare. This particular individual was on a skiing trip out west, or he was on a trip out west, and had come into contact. That's where he believed he had come into contact with someone with the virus. He had come back. He had some symptoms, but kind of dismissed them because they were minor. Did some procedures, and found out later after he did the procedures that he came into contact with this individual. Submitted himself for testing. The test was run, and 24 hours later the test came up and it was positive. So immediately we called Saginaw County Health Department, the Midland County Health Department, because there were some connections with that too, and Covenant Healthcare. We got together because we needed to know if he did do procedures on people. We needed to have both the hospital reach out and the health departments reach out and start investigations and start notifying these people that they were at risk. And that took place. It took place over a period of about 24 hours. I've got a fantastic staff. They were right on it. We worked through the weekend on this. The individual, the physician, was really good to work with as well. He quarantined in place, submitted, and did what he needed to do. Right. And most of the people that we called were very, very grateful for us to notify them.
And again, this response to the pandemic is unprecedented, as you said. I mean,
Absolutely.
You've been, the health office is there for 7 years, and you've never seen anything like it. I don't think we've,
No.
in this country, we've seen anything like it in a long time. However, talk about this response in respect to some we've seen in recent history. I mean, I can just go back 10 years ago with the H1N1,
Sure.
which we didn't have this kind of response, and 500,000 people globally died. There were others. There were MERS, there were SARS. We haven't had this response. So what is it about this coronavirus, this COVID-19, that has generated this response versus the others?
So coronavirus is kind of the family of viruses, and it includes influenza, includes MERS, it includes SARS, it includes this particular virus, the COVID-19, which, to what we know, may have originated in China. What's particular about this is that there's a couple of different things. Number one, it really resembles a common cold for most people, 80%. 80% of people that get it recover. They may have anywhere from no symptoms to minor symptoms, but it's just the inconvenience of a minor cold. For that other 20%, and I talked about the risk, the groups with the highest risk factors, that's where the problems occur. And for one reason or another, just like in some pandemic flus, there are certain populations that have an overreaction to fighting the virus, and that's what is particularly taking place here. For one reason or another, it seems to be more troublesome for seniors and people with chronic diseases, while younger people tend to recover pretty quickly. Now, if you compare this to, we're going to not compare it to H1N1 because, and I'll explain the difference between that, but there was a pandemic flu in 1918 during the First World War that killed 5 million people worldwide. It actually hit America pretty bad. There was more casualties, or more people dead from that than in World War I. And any history buffs before this, while this was kind of brewing up in China, I started to look at Bay City Times articles on pandemic influenza. And you'll notice that there is a lot of similarities between the two events happening, where at first it was like, no, it's just the flu, it's not that big of a deal, don't worry about it. And then as it ramps up and more and more people get it, more people die from it, the community becomes very alarmed. School was canceled in 1918 from the middle of October till after Christmas.
Wow.
I mean, we don't hear about that.
No.
But the major difference between the 1918 influenza pandemic and this particular thing is that the 1918 influenza really attacked young, healthy individuals, and it left the elderly and infirm mostly alone, where this is just the opposite.
Wow.
Now, H1N1, when that first occurred, there was really a more coordinated response at the federal and at the global level on that. And I think we got the first notifications on that in April, and then by October we actually had the vaccine. There is a vaccine in development for coronavirus. It's not going to be ready for 18 months.
Right.
So we have to use other means to fight this.
Well, the other issue is getting enough tests, getting people tested, and
Yes.
we can't do that fast enough. What's sort of the update on that, at least in your county, how quickly we can get more people tested?
Well, every day we have multiple communications with the Michigan Department of Health and Human Services. And as of right now, there are 3 ways that you can get tested. Number 1 is that you can get tested through kits provided by the Michigan Department of Health and Human Services, but there's some parameters behind those tests. And providers, we're trying to get those 2 providers, but they're not widely available, and they're not widely available in Bay County right now, and that's part of the problem. They're not widely available throughout the state. But even if they were, the state's lab capacity is pretty limited right now. And I know they're ramping that up, but they can only run so many hundred of these tests per day. There are opportunities right now to get tested through private labs such as LabCorp and Quest, but they're also having some problems with logistics.
Mm-hmm.
And they're hoping to get those things worked out this week as well. Really what we need to see is the expansion of testing beyond those 3 sources so that hospitals can do the test, that other private laboratories can do the test. So I think in order for that to happen, there needs to be some waivers done at the federal level in order for that to be done. But I think that's going to happen sooner than later. But even with that being said, if you're tested, it will tell you 1 of 2 things. 1, it will tell you that you have the coronavirus, or it will tell you that there's just not enough antibodies that have built up to tell you that. So that doesn't mean that you're free and good to go. You may get it later on, but at that particular time, you don't have it. So what we're explaining to people is don't try to obtain a test if you're healthy. If you have symptoms, call your provider first. Maybe they can get a test set up for you. But for the majority of people, they can ride the overwhelming majority of the people can ride out the illness at home, and especially if they isolate themselves. And I'm not talking about anything difficult.
Mm-hmm.
It's the same thing if you had norovirus or some kind of gastrointestinal illness
Sure.
where you're throwing up. You're going to isolate yourself from
Absolutely.
your family.
Right.
Yeah, and so in the same vein, you're going to be doing that as well, too.
Right. Well, while we're talking, I want to put some numbers and some websites on the screen right now. We'll continue to talk to show our viewers. When Joel and I are done this evening, jot these numbers down, get a pen and paper for the COVID-19 hotline. There's the number on your screen. That's here in Michigan, and keep in mind that will only be open 7 days a week from 8 to 5 during the day. So if you're calling at this time of night, they're not going to answer it, so 8 to 5. And of course, there's the website here in Michigan, the CDDC nationally, and here in Bay County. You know, in some regions they're sheltering in place.
Mm-hmm.
Others are completely quarantined. Obviously, here locally, many of us are just told to stay home.
Sure.
Restaurants, bars, movie theaters, malls closed. So why stop there? Wouldn't it make the best sense to say, you know what, we've gone this far, let's just go all the way for the next 2 to 3 weeks, just sort of shut everything down except for essential services like healthcare and
Yep.
grocery stores. What do you make of that? Do you think we're getting to that point? Because we've kind of been doing it in pieces, right?
Yeah. Well, well, we do it in pieces, but we did it in a week,
Yeah?
and that's pretty
Right.
fast. It's not happening all at once.
Right.
One of the things with it is that what we've got to do is take this kind of one step at a time, day by day. I understand that they've done it in, complete shutdown in San Francisco. They're trying to avoid an Italy type of scenario. And there are a number of cases in Northern California where it would warrant that. I wouldn't be surprised if it happens in New York City. Sometimes these things are very difficult to enforce. I'm not sure where we're at with that in Michigan, but the one thing is, if you would have asked me a couple of days ago, I thought we were going towards national shutdown. I'm not so sure of that today, but things can change. I mean, they do change in 10 hours, 12 hours, 24 hours. But the one thing, too, that you need to realize, that the viewers need to realize, is that cities and localities are often like individuals. So Metro Detroit would have, you see a cluster of cases there. You probably want to isolate those cases there as much as possible. You only see one case right now in Bay County and none in Saginaw or Midland. But there's the very real possibility that it is spread beyond that as well. There's been more than one person tested in Bay County. There's probably been 30 so far. I know that 7 have come back negative in Bay County. We're still waiting on some of the others. And we have some people that have been admitted into the hospital, but we don't know what they have right now. But there is going to be a part of community spread. The whole point, though, is that instead of having that spike go up, that we're trying to, what they call, flatten the curve. So that the illness might last longer, the duration of the illness in the community may last longer, but the effects are really absorbed much better than trying to overwhelm the system all at once.
I think it's interesting. Again, it's unprecedented. I think the response, I think globally, nationally, locally, has been tremendous.
Yes.
They've really come together in really a unified way. Yeah, it's been a little confusing. We've brought these rules and guidelines out piece by piece, but it's amazing because we haven't seen anything like this before. And there's a lot of misinformation, right? You and I were talking earlier about social media, why it can be a good thing to get some information out to people, blitz it out there, but it's also a lot of misinformation. So I'm going to run down some of these frequently asked questions that you provided through the county.
Okay.
One is, how is it spread?
Just like the flu is spread.
Yeah.
Sneezing, droplets, being close to someone. You can pick it up from surfaces. The one key thing that we have heard, it's not, we need to find out more about it, but it seems that the viral load is much, much higher than the flu is, much, much higher than SARS and MERS were, and that's part of the reason why it spread so easily.
Right.
And that's part of the reason too why SARS and MERS didn't spread so easily, because the viral load was much lower.
Right. We need to prepare, but don't overdo it, right? No need to hoard toilet paper and hand sanitizer.
Yeah.
The world has gone crazy. I mean, personally, I can tell you over the last 3-4 days, I've been to so many different places that shelves are empty of toilet paper, literally 5 minutes after. But that's sort of unnecessary, right?
Yeah, that's very much unnecessary. The supply chain still exists and it's still working. There will be toilet paper there in supermarkets tomorrow. There will be personal supplies in the supermarkets, in the markets next week. There's no reason to hoard anything. The same thing with hand sanitizer. You can do a much more effective job with a bar of soap that's used by a number of people in hot water or soap and water than you can do with hand sanitizer. Don't get me wrong, hand sanitizer is the next best thing after soap and water, but soap and water is the best way.
Okay. What do I do if a loved one gets sick?
Okay, so let's say that you have a family member that gets sick, and we use the norovirus comparison. Number one is you want to isolate that person in your home, especially if there are people that have compromised immune systems, or if you've got elderly relatives or friends living with you. You want to have one caretaker for that person. Chances are 80% will recover pretty quickly. You can stay in bed for a couple of days. It's not going to kill you to stay in bed for a couple of days. I know for some people, it's like, I have a small child, they don't want to just sit there in bed and everything like that. But you've got to try to isolate them as much as possible. You need to monitor their symptoms, obviously. And you need, when you're taking care of them, if you can have them wear a mask somehow, and if you can wear gloves and frequently wash your hands and clean surfaces, disinfect as much as possible, that will go a long way. Please, don't share cups and utensils and things like that. Really try to isolate that person as much as possible, but make them comfortable so that they can ride out the illness. And typically 2 days beyond, the rule of thumb right now from the CDC is 3 days beyond having symptoms, it's okay to go back to work or go back to activities and things like that.
Well, then it comes to the healthcare workers. How do we better protect them? Home healthcare workers, folks that work in nursing homes, physicians, including the one physician that got this virus. Is there anything more
Sure.
we can do to protect that sort of front line of defense?
Well, communication is the key
Yeah.
with this whole thing. Number one, finding out if they're going out, for home health care workers, maintaining a good rapport communication with the people that they care for, making sure that they're monitoring symptoms, making sure that they're monitoring and taking care of their own health, that they're taking care of themselves. But one of the key things is for people that are symptomatic to not panic, not go to the emergency room, not just visit their doctor and say, oh, I need to be tested for this right away, or I don't know what I have a slight fever and a slight cough. Call the provider first. Get their advice on what to do. Most providers will say, and based on our guidance as well, go home if it's just a slight cold, a slight fever, even if it's moderate, you have a moderate fever, see if you can take care of the symptoms at home and get better. If you can't, if you're starting to really have issues like chest pain, shortness of breath, where you feel that your life is in danger, by all means call 911, go to the emergency room.
You just came from a meeting with first responders.
That's correct.
Here locally, and raced over here. I can't imagine what your day was like. Can you talk to me a little bit about what that meeting was about, the things you discussed, and how you're sort of mobilizing that part of it?
Well, the healthcare system just isn't hospitals and doctors in the emergency room. It really is hospitals, doctors, the emergency room, providers in the community, home health care units, long-term care facilities, the health department, and first responders, because most first responders go along with ambulances. So one of the things that they're concerned about, and we're concerned about as a community, is that they can be overwhelmed pretty fast. And if they enter into situations without the proper protective equipment on, or they don't have the proper precautions, can be vulnerable to this disease as well. So we talked about good strategies to employ. They're doing some screening with Bay County Central Dispatch 911, and they're working closely with McLaren and some of the other healthcare providers and some of the other EMS providers to make sure that they're using the right scenarios to engage people and making sure that there's proper protective equipment being used and that all the proper precautions are being used.
Okay. You mentioned we're trying to flatten this curve. We don't want to see
Absolutely.
what happened in China or Italy. Looks like South Korea did a pretty good job of testing people, and they got through it okay. What I heard today is China's cases have dwindled down to just a handful, which is a good side. So at least in the United States right now, is that a good sign to see some of that's dwindling? Are we learning from what they did in terms of our response, do you think?
Well, I think the key thing with China is you have to remember there's two different types of government. You've got in China pretty much a totalitarian state, and you got in the United States a free market economy and a democracy. So it's very difficult to replicate what they did in China. So that's one thing. And then, they expected people to stay in place for 4 to 6 weeks. It's very difficult to do with that. In Korea, it was a little bit different. They tested sooner. Actually, Taiwan is probably the gold standard too, because they were on this as of January 2nd. But then again, it's different variations of what people are willing to do collectively in society. And I think that's one thing that's going to change as a result of this, is that we are all going to be more aware of not only ourselves as as the whole of society, but our own particular responsibilities as citizens in our country and our community.
I know you can't predict the future. This could go anywhere from 4 weeks to 4 months. We just don't know. So what do you see as the next step, certainly in Bay County? Will we see drive-through testing? What else do you see in the horizon, at least in the short term?
Well, we're planning for a couple of different things. We're planning to get more testing kits and supplies out to providers. I would love to get drive-through testing, but once again, like, I can test 1,000 people, but if I got to wait 8 days to get the results, that may be counterproductive. Plus, I want to test people that have slight symptoms or pretty big symptoms.
Sure.
And if I test people with no symptoms, that they may become symptomatic later. So there's another issue with that. But we're also working with the hospitals, and particularly McLaren and Bay County, to anticipate the coming surge, because we know that there's going to be a coming surge. And do we need to obviously expand upon how they're going to react to this? They've already cut back some elective procedures there.
Right.
They may do some more in the coming days. I wouldn't be surprised if that happens. But in addition to that, do we need to leverage some resources, both state and nationally, where we can set up alternate sites of care other than the hospital itself?
Right. Going to ask you one more question, and
Sure.
I want to show that information on the screen one time, the phone numbers and the websites for people to call when Joel and I are done here in about 45 seconds or so. That's the hotline number. Again, that's 7 days a week here in Michigan, 8 to 5. That's the Michigan website for the coronavirus, the CDC, and also in Bay County. Any last words of advice here as we end the show here in about 30 seconds?
Well, everybody needs to do their part.
Yeah.
Maintain social distancing of 6 feet. Make sure that if they're sick, they're staying home. Good hygiene practices, constant cleaning, and being vigilant about their health and their family's health as well.
Well said. Again, thanks for coming in. I know there's a lot on your plate, and good luck mobilizing those folks to get ahead of it, and I think you're doing a great job, so thank you very much.
Thank you.
And thank you for joining us. We'll stay on top of this over the next few weeks, and we'll see you here next week at 8 o'clock with a follow-up. Have a good night, everyone.